Mesothelioma treatment options. Surgery. Surgery is often one of the main treatment options for mesothelioma, especially if the cancer is discovered early before it has spread too far. The main surgeries for mesothelioma include extrapleural pneumonectomy, EPP, pleurectomy, decortication, PD, and lung-sparing surgeries such as partial pleurectomy. EPP removes the affected lung, diaphragm, and lining around the heart. 3D surgery aims to remove as much of the tumor and lining of the lung and chest wall as possible without removing the entire lung. Lung-sparing surgeries attempt to remove just part of the lung with the tumor. Chemotherapy. Chemotherapy involving a combination of several drugs is usually recommended after surgery to try and destroy any remaining cancer cells. Common chemotherapy drugs used for mesothelioma include pemetrexed, cisplatin, and carboplatin. Chemotherapy may also be recommended for unresectable or metastatic mesothelioma to help control symptoms and extend survival. It is often given with radiation therapy for this stage of disease. Radiation therapy. Radiation therapy uses high-energy X-rays or other particles to destroy cancer cells and shrink tumors. For mesothelioma, radiation may be used as the primary treatment for unresectable disease or as adjuvant therapy along with chemotherapy after surgery to further destroy any remaining cancer cells. Common radiation therapy techniques used include intensity-modulated radiation therapy, IMRT, stereotactic body radiation therapy, SBRT, proton beam therapy, and photodynamic therapy. Targeted therapy. Targeted therapies are newer treatment options that block the abnormal growth and spread of cancer cells by interfering with specific molecules involved in tumor growth and progression. The two main targeted therapy drugs approved for mesothelioma are bevacizumab and rindapepimut. Bevacizumab blocks new blood vessel formation in tumors, and rindapepimut is an immunotherapy drug that stimulates the immune system to recognize and destroy cancer cells. Ongoing trials are also exploring other immunotherapy and targeted drugs. Clinical trials. Clinical trials are actively investigating new mesothelioma treatment approaches. These include immunotherapy drug combinations, new chemotherapy regimens, gene and viral therapies, and studies exploring more personalized treatment based on tumor biomarkers and genetic profiles. Participating in a clinical trial may provide access to newer treatments not yet available elsewhere. Trials are always an important option to consider. Supportive care. Managing symptoms and improving comfort and quality of life are important goals of treatment, especially in later stages. Procedures and medications to control pain, fatigue, shortness of breath, and other symptoms are an essential part of care. Palliative care focuses on holistic comfort and support regardless of disease stage or prognosis. Support groups can also help educate patients and provide emotional support. Overall, treatment decisions depend on the specific clinical and pathologic factors in each patient's case, including tumor type, stage, location, and overall health status. A multidisciplinary care team jointly develops the best individualized therapy plan for optimal outcomes while preserving quality of life. Close monitoring is also important given the risk of recurrence over time. Colon cancer treatment options. Surgery. Surgery is the most common treatment for colon cancer and is often potentially curative if the cancer is caught at an early stage before it has spread. The main types of surgery include colectomy to remove the cancerous section of the colon, and hemicolectomy to remove roughly half of the colon. For some patients, laparoscopic or robotic-assisted minimally invasive surgery is an option. Chemotherapy. Adjuvant chemotherapy using a combination of drugs such as 5-FU, leucovorin, oxaliplatin, and irinotecan is usually recommended after surgery to destroy any remaining cancer cells and reduce the risk of recurrence. Chemotherapy is also a main treatment option for metastatic colon cancer to help control symptoms and slow disease progression. Radiation therapy. Radiation therapy may be utilized along with chemotherapy for colon cancer patients with rectal cancer due to the proximity of the tumor to sensitive organs in the pelvis. It is delivered after surgery to help control cancer cells that may remain and prevent recurrence in the pelvis. Intensity modulated radiation therapy, IMRT, allows higher doses to be focused on the tumor while limiting surrounding tissue exposure. Targeted therapy. The main targeted therapy drugs used for metastatic colon cancer are cetuximab, panitumumab, regorafenib and ramucirumab. These drugs block specific molecules involved in cancer growth and spread like EGFR and VEGF. Cetuximab and panitumumab are given with chemotherapy while regorafenib and ramucirumab are used after all other standard options have been attempted. Immunotherapy. Immunotherapy has become an exciting new treatment approach, particularly for colon cancers that are microsatellite instability high, MSIH, or mismatch repair deficient. Drugs like pembrolizumab and nivolumab that work by releasing brake on the immune system have shown promise in clinical trials. Ongoing research is expanding use of immunotherapy for colon cancer. Clinical trials. Participating in a clinical trial can offer access to new treatment approaches not available elsewhere. Studies are actively exploring immunotherapy combinations, novel targeted agents, vaccines, and personalized treatment strategies based on biomarkers or genetics. Trials provide an important option, especially for later-stage disease. Supportive care. Controlling symptoms like pain, fatigue, nausea and maintaining nutrition are priorities, especially as the disease advances. Palliative care focuses on relieving suffering and enhancing quality of life no matter the disease stage or prognosis. Support groups help patients and families cope with challenges. As with mesothelioma, the optimal colon cancer treatment plan combines one or more of these approaches based on each individual's specific situation, incorporating also priorities around maximizing both length and quality of remaining life. Close monitoring long-term is also crucial given the potential for recurrence even years later. An experienced multidisciplinary team is essential for optimal outcomes.